We now have our final keynote, which is about achieving more with less, inspiration from India. And I think we can all draw inspiration about how to do more with less money in the current economic climate. Sadly, we haven't got Devi Shetty with us. A whole host of issues have conspired to prevent us seeing his face live, but he is able to join us by a pre-recorded video, and then we're going to speak to him by phone. So all being well, we will get the essence of Devi Shetty. And first of all, here is the pre-recorded video.
Good morning, friends. I'm sorry I couldn't address you personally. I'm extremely grateful to the organizers for giving me this opportunity. I'm a cardiac surgeon by profession, and we run a chain of super specialty hospitals across the country. Our intention is to perform cardiac surgery for $800. Today, cardiac surgery at our institution costs about $1,800. Incidentally, our hospital is accredited by Joint Commission of United States. My country requires 2.5 million heart surgeries a year, and all the heart hospitals in the country put together perform less than 120,000 heart surgeries. What happens to the rest? They perish gradually over a period of time. We are genetically 3 times more vulnerable for heart attack than Caucasians. We Indians develop heart attack at a much younger age. In my practice, it is not the young son bringing his old father for a heart operation. It is the old father bringing his young son for a bypass grafting. If a solution is not affordable, it is not a solution. Because of the high cost of heart surgery, today we are perhaps producing one of the largest number of young widows in the world. How long we are going to tolerate this? Something has to be done. So about 10 years ago, we convinced our government, state of Karnataka, the government of state of Karnataka, to launch a health insurance with a premium of 11 cents per month. Our government agreed to become a reinsurer. First year we had 1.7 million farmers who agreed to pay 11 cents per month. We tied up with 400 hospitals across the state. There are 1,650 varieties of surgeries done on the human body, and we agreed to perform all these operations free of cost under the scheme. The scheme became a major success because people could get even a major heart operation done for 11 cents per month. At the end of 10 years, few 100,000 had varieties of operation, few thousand people had heart operation. This is the power of people. Poor people in isolation are weak. Together we are very strong. Today we have 4 million farmers paying 22 cents per month, and they can get any surgery done, including a heart operation. We believe that it's a matter of time before governments across the country will become a health insurance provider. When this massive shift happens, we need to relook at the way we build the hospital. The hospital where I am working in Bangalore, Narayan Hrudayalaya, we have a 1,000-bed heart hospital. We have an infrastructure to perform 60 major heart surgeries in a day. Currently, we perform between 30 to 35 heart operations in a day. our desire is to build 100 heart and super specialty hospital across the country, because we have 100 towns in India with a population of over 500,000 to 1 million where there is no heart hospital. But these towns do not have wealthy people to sustain this expensive hospital. So we worked with India's largest construction company called L&T and built a new concept of building super specialty hospital. We had two conditions with L&T. First condition is that a 300-bed heart hospital should be built and equipped for $6 million. And we wanted the heart hospital with 300 beds to be built in 6 months. L&T, the construction company, agreed with the terms, and they built this hospital in a place called Mysore, which is about 2 hours away from Bangalore. Hospital is ready, commissioned, and we are doing all types of surgeries, including heart operation. Of course, we spent $7 million, including the equipments. We couldn't build the hospital in 6 months. We spent 8 months. But the next project will be done for $6 million. In this hospital, the ward and the rest of the areas are not centrally air-conditioned. Only the operating rooms and the ICU are air-conditioned. In a tropical country, air conditioning doesn't prevent infection. It is the commonest source of infection. In this hospital, nursing care after the surgery, when the patient is in the ward, is not provided by the nurses. It is provided by the trained family member or the spouse. We worked with Stanford University to develop a curriculum with audio-visual to train the spouse to be the primary healthcare provider in the ward. Who can be a better nurse than the spouse? We have to just educate them. We are greatly concerned about the safety of healthcare for a patient in the hospital. Getting admitted to a modern hospital in US or Europe is 10 times riskier than skydiving. It's mainly because we don't follow the process, protocol, and procedures. Every doctor has his own style of treating patients. This is how aviation industry was 50 years ago, when major accidents were not uncommon. But then all the wise men got together and came up with the rigid regulatory structure to prevent these accidents. Today, a pilot who has 25-year experience or 5 years experience can take off, cruise, and land the same manner. But in healthcare, unfortunately, everyone has their own style of treating patients. Healthcare is not standardized. We believe that within 5 years, smart software will make smarter diagnosis than doctors. We believe within 10 years, it will become legally mandatory for the doctors to take a second opinion from the software before starting the treatment. We have started working in this direction. We are in the process of replacing all our ICU charts with an iPad, which is driven by an app. This app will guide the nurse to do the right things at the right time, and we believe that this will have a big impact on the outcome of healthcare. Ultimately, it's a technology which will bring down the cost and it will make healthcare more efficient and safe for the patient. We invested heavily on technology. We have an Oracle ERP solution which is on a cloud. We have 21 hospitals across the country. Every day at 12 o'clock in the afternoon, our senior doctors, senior administrators get a SMS on their mobile phone with yesterday's revenue, yesterday's expenses, and yesterday's EBITDA margin. For us, looking at the balance sheet at the end of the month is like reading the post-mortem report. Looking at the balance sheet on a daily basis is a diagnostic tool which will help you to come up with remedial measures. Once again, no matter how good the outcome of healthcare is, if it is not affordable, it is not a solution. We believe that India will become the first country in the world to dissociate healthcare from affluence. 10 years down the line, we will still have millions of people living in the slums with no amenities, but when they are unwell, they will have access to high-tech healthcare with dignity. India will prove to the world that the affluence of the nation has nothing to do with the quality of healthcare its citizens can enjoy. We can do it because we produce the largest number of doctors in the world. We produce the largest number of nurses in the world. We produce the largest number of medical technicians in the world. Outside the US, we have the largest number of US FDA-approved drug manufacturing units. We have everything required for a phenomenal healthcare delivery model. Our missing link is that our people do not have the cash money to pay for it. But we will use technology to make it happen. We have 900 million mobile phone subscribers. Most of them spend 150 rupees a month just to speak on the mobile phone. And all we want is 20 rupees out of that, and we can give health insurance for 900 million people through their mobile phone, which is not a large amount of money. We are an amazing country where unbelievable things happen at a record time. We are proud to be Indians. Thank you very much, and I'm extremely grateful to you for giving me this opportunity.